Ignore these eczema signs and your skin could suffer for life. Hello everyone, and a special welcome to the esteemed members of our senior community. Today we're going to delve deeper into a common yet often misunderstood skin condition, especially among older adults, eczema, also known as atopic dermatitis. Perhaps you or a loved one have experienced the uncomfortable sensations of itchiness, dry, rough skin, or inflamed, reddened patches. These symptoms can not only cause physical discomfort, but also significantly impact sleep, mood, and even our daily activities. Eczema isn't just a childhood issue. It can appear for the first time or flare up intensely in old age, bringing with it unique challenges and requiring a specialized approach to care. In this comprehensive video, we will explore every aspect of eczema in seniors. We'll explain exactly what eczema is, why it manifests differently in older age, its contributing factors, how it's diagnosed, and the most advanced treatment options available today. Furthermore, we'll provide practical, easy-to-implement advice so you can effectively manage your skin health and significantly improve your quality of life. Before we begin this informative journey, it's crucial to understand a vital disclaimer. All information shared in this video is intended for general educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment from qualified healthcare professionals. If you have any concerns about your skin health or any other medical condition, please consult with your doctor or a qualified healthcare provider. Your health is our utmost priority, and seeking personalized advice from a professional is essential to ensure you receive the most appropriate care for your specific situation. With that understanding, let's embark on this journey to learn about eczema and equip ourselves with the knowledge to live healthier, happier lives. Part 1. What is eczema? Atopic dermatitis. To better understand eczema in seniors, we first need to grasp the fundamental knowledge about this condition. Eczema, medically known as atopic dermatitis (AD), is a chronic, inflammatory, non-contagious skin condition characterized by dry, itchy, red, scaly skin and sometimes small blisters or oozing. A key aspect of atopic dermatitis is its association with the atopic triad, which includes atopic dermatitis asthma and allergic rhinitis hay fever. This means that individuals who suffer from eczema often have a strong genetic predisposition to develop other allergic conditions throughout their lives, suggesting a common immune mechanism underlying these conditions. At the core of eczema is a dysfunction of the skin's protective barrier. Imagine our skin as a sturdy brick wall, where individual skin cells are like the bricks, and lipids, natural fats, such as ceramides, cholesterol, and fatty acids, act as the mortar binding those bricks firmly together. In individuals with eczema, this mortar is compromised or deficient, leading to gaps and weaknesses in the skin's protective wall. This impaired barrier function causes the skin to lose moisture much more rapidly than healthy skin, resulting in chronic dryness. Simultaneously, these gaps allow irritants from the external environment, allergens like pollen dust, mites, pet dander, and even bacteria to penetrate more easily into the deeper layers of the skin. Once these agents bypass the barrier, they trigger an excessive inflammatory response within the skin's immune system, leading to the characteristic symptoms of eczema. So what causes this dysfunctional skin barrier and the abnormal immune response? A complex interplay of several factors contributes to the development of eczema, including genetic predisposition, immune system dysregulation, and environmental influences. Genetics play an extremely significant role in determining an individual's risk of developing eczema. If your parents or siblings have a history of eczema, asthma, or allergies, your risk is substantially higher. Scientific research has identified several specific genes linked to eczema, with the most notable being the gene responsible for producing filaggrin. Filaggrin is an essential protein vital for the formation and maintenance of a healthy skin barrier function. It helps reinforce the structure of the stratum corneum, the outermost layer of the skin, and contributes to the skin's natural hydration process. A deficiency or defect in the filaggrin gene results in a compromised, vulnerable skin barrier, making the skin prone to water loss and dryness, and increasing its permeability to irritants and allergens from the external environment. Beyond genetic factors, dysregulation within the immune system is another fundamental cause. In individuals with eczema, the immune system overreacts to otherwise harmless substances in the environment that would not cause any problems for healthy individuals. For example, Pollen household dust mites, pet dander, or mold growing in damp areas can be mistakenly identified by the immune system of someone with eczema as harmful invaders. This exaggerated immune response leads to a cascade of inflammatory events in the skin, causing symptoms like redness, swelling, and intense itching. Instead of merely protecting the body from genuine threats like pathogenic bacteria or viruses, the immune system initiates an unnecessary inflammatory response, contributing to the vicious cycle of eczema. Furthermore, our surrounding environment contains numerous factors that can trigger or exacerbate eczema flare-ups. These factors, known as triggers, are highly diverse and vary from person to person. Allergens constitute a large group, including airborne pollen dust mites lurking in bedding and carpets, animal dander from pets, mold that thrives in humid conditions, and in some cases certain foods. Though the role of food in older adults is less clear and more complex than in children. Irritants form another category, encompassing harsh soaps, abrasive household cleaning chemicals, fragrances, alcohol-based cosmetics, or rough fabrics like wool and synthetic materials that can rub against and damage the skin. Temperature and humidity changes also play a significant role. Dry, cold air in winter can rapidly dehydrate the skin, while excessively hot temperatures leading to sweating can irritate the skin and intensify itching. Stress does not directly cause eczema, but can undeniably worsen flare-ups through the intricate interplay between the immune and nervous systems. When under stress, the body produces hormones that can influence the skin's inflammatory response. Lastly, skin infections caused by bacteria, most commonly Staphylococcus aureus, or viruses such as herpes simplex, can significantly aggravate eczema, turning a typical flare-up into a serious medical issue requiring urgent intervention. One of the most prominent and distressing characteristics of eczema, and indeed the factor responsible for much of the skin damage, is the itch-scratch cycle. Intense, persistent itching is the primary and unavoidable symptom of eczema. When the skin itches, the natural human response is to scratch. However, scratching, even if seemingly light, further damages the already weakened skin barrier, creating tiny abrasions, sometimes imperceptible to the naked eye. These micro-injuries compromise the skin barrier even further, allowing irritants and bacteria to penetrate deeper, leading to a more severe inflammatory response. This inflammation in turn makes the skin even drier, redder, and itchier, thereby compelling the individual to scratch even more. This vicious cycle continues, causing severe skin damage, impeding the healing process, and making eczema incredibly difficult to control. In older adults, this cycle can be particularly challenging to manage because their skin is already thinner and more fragile due to natural aging, and the body's healing capabilities are slower compared to younger individuals, trapping them more severely in this relentless loop. Understanding the nature of eczema and its influencing factors is the crucial first step towards effectively managing it. Part 2. Why is eczema unique in seniors? Eczema is not exclusively a childhood condition. It can manifest for the first time in older age, a phenomenon known as late-onset eczema, or it can vigorously recur after many years of remission, referred to as persistent eczema. What makes eczema in seniors distinct are its specific characteristics and unique challenges that we must recognize to ensure effective diagnosis and treatment. These differences stem from the natural physiological changes our skin undergoes as we age, as well as general health factors and lifestyle considerations commonly encountered in this age group. As we age, our skin experiences numerous significant natural changes, making it more vulnerable, sensitive, and susceptible to various skin conditions, including eczema. One of the most prevalent and impactful changes is chronic dry skin, medically termed xerosis. With advancing age, the sebaceous glands responsible for producing natural oils that help moisturize the skin and sweat glands become less efficient. This leads to a considerable decline in the production of essential lipids and natural moisturizing factors in the skin, causing it to lose moisture more readily, becoming dry, flaky, and feeling tight and uncomfortable. Dry skin is more prone to itching and cracking, creating an opportune environment for external irritants to penetrate deeper into the skin, triggering inflammation and exacerbating eczema. Furthermore, the skin's natural protective barrier, which we previously referred to as the brick wall of the skin, significantly weakens in older adults. This decline is due to a multitude of factors, including reduced production of critical lipids like ceramides, and cholesterol essential proteins like filaggrin and natural moisturizing factors, NMFs. The stratum corneum, the outermost layer of the skin which acts as a physical shield, also becomes thinner and less robust with age. All these changes diminish the skin's protective capabilities against harmful external agents and concurrently reduce its ability to retain water, rendering it more sensitive and prone to damage by eczema-contributing factors. Another seemingly contradictory but important point is that while older skin may be more prone to inflammation, their overall immune response can be partially diminished, a phenomenon known as immunosenescence. This can lead to eczema symptoms in seniors being less typical or harder to recognize compared to younger individuals. For example, the degree of redness or swelling might not be as pronounced as in younger people, yet the sensation of itching can be far more intense and persistent. Finally, the skin's ability to heal wounds slows down considerably as we age. Skin cells regenerate at a slower pace, and the tissue repair process takes longer. This means that scratches or lesions from eczema will take more time to heal, increasing the risk of secondary infections and prolonging the inflammatory cycle. Beyond these physiological skin changes, general health issues and lifestyle factors common in older adults also significantly influence eczema and its manifestation. Older adults often contend with multiple medical conditions simultaneously, a state known as multimorbidity. Conditions such as diabetes, cardiovascular disease, Parkinson's disease, hypothyroidism, or other autoimmune diseases not only affect overall health, but can directly impact skin health or how the body responds to eczema treatments. For instance, diabetes can cause dry skin and increase the risk of infections worsening eczema. Alongside multimorbidity, polypharmacy, the concurrent use of multiple medications, is also a common issue in seniors. Some prescription medications for other medical conditions can have side effects that include dry skin itching or even exacerbate existing eczema. For example, diuretics often used for high blood pressure can lead to drier skin, and some cholesterol-lowering medications, statins, can have similar side effects. This underscores the importance of thoroughly discussing all medications, including over-the-counter drugs and supplements you are taking, with your doctor, so they can assess potential interactions and adjust your eczema treatment plan accordingly. For older adults with cognitive impairments, e.g., dementia, Alzheimer's disease, or limited mobility, performing daily skincare, applying moisturizers correctly, or adhering to medication regimens can become incredibly challenging. In such cases, dedicated support from caregivers is absolutely essential to ensure that treatment is administered consistently and effectively. Inadequate nutrition or dehydration can also severely affect overall skin health, worsening dry skin and inflammation, thereby making eczema more difficult to control. Finally, psychosocial factors such as loneliness, depression, anxiety, and stress, common issues in older adults, can exacerbate eczema flare-ups through the complex interplay between the brain, immune system, and skin. Chronic stress can trigger inflammatory responses and intensify the sensation of itching. Differences in symptom presentation are another crucial aspect of eczema in older adults, potentially leading to delayed diagnosis or misdiagnosis as other skin conditions. Instead of typically appearing in skin folds like the elbows or behind the knees, common locations in children, eczema in seniors often affects the trunk, back, abdomen, limbs, arms, legs, and especially the hands and feet. The face is generally less affected. The type of skin lesion can also vary. Instead of typical red patches, eczema in older adults might manifest as generalized dry, itchy skin without a distinct rash. A common form is nummular eczema, characterized by round or oval, red, itchy, sometimes scaly or crusted patches often appearing on the legs, arms, or trunk. Another form is astiotic eczema, where the skin becomes extremely dry and cracked, resembling dry, cracked earth, particularly prevalent in winter or among those who take frequent hot baths. The intensity of itching is often severe, especially at night, causing significant sleep disturbances and greatly impacting quality of life. Chronic itching can also lead to thickened, darkened skin lichenification due to persistent scratching. Because older skin is thinner and more fragile, seniors are at a higher risk of developing secondary infections caused by bacteria like Staphylococcus aureus or viruses like herpes simplex in eczema-affected areas, which necessitates prompt medical intervention. These differences highlight the importance of early recognition and seeking appropriate medical care to ensure accurate diagnosis and an effective treatment plan. Part 3. Symptoms and diagnosis in seniors. Recognizing the symptoms of eczema in older adults can be more complex than in younger age groups, due to overlapping features with other skin conditions or atypical presentations. However, early detection and accurate diagnosis are key to effective management and treatment, helping to alleviate discomfort and improve quality of life. While each person may experience different manifestations depending on the severity and individual factors, here are the most common and characteristic symptoms of eczema in older adults. Itchiness pruritus is the most prominent and often the most distressing symptom. The sensation of itching can range from mild to severe, constant or intermittent, and it frequently worsens at night or after a hot shower. In older adults, chronic itching is often the primary hallmark of eczema. Sometimes it may even appear without obvious skin lesions, at first making diagnosis more challenging. Patients typically experience an uncontrollable urge to scratch, leading to a vicious itch-scratch inflammation cycle. Nearly all older adults with eczema also experience chronic dry skin xerosis as a co-occurring symptom. The skin may appear flaky, scaly, rough, or feel uncomfortably tight. Prolonged dry skin further weakens the protective skin barrier, making the skin more susceptible to irritation and exacerbating the sensation of itching, creating an entry point for external agents. Affected skin areas often appear red or pink due to inflammation. In individuals with darker skin tones, these areas might look brown-gray or purplish instead of bright red. Inflammation is the body's natural response to irritation and skin damage. Persistent scratching due to intense itching leads to scratches or breaks in the skin known as scratch marks or skin lesions. Over time, due to chronic scratching, the skin in affected areas can become thicker, darker, hyperpigmented, and develop prominent skin lines, a condition called lichenification. In some more severe cases, the skin may crack, bleed, or form small blisters that can ooze when ruptured. Regarding the location of lesions, as mentioned, eczema in older adults often affects drier skin areas, or those subject to more friction, such as the trunk, back, abdomen, arms, legs, and especially the hands and feet. The face is typically less affected compared to children. Additionally, eczema in older adults can present with atypical manifestations, making recognition difficult. Sometimes it may simply manifest as generalized, unexplained itching without a distinct rash. Alternatively, it can appear as nummular eczema, characterized by round or oval red, itchy and scaly patches often found on the legs, arms, or trunk. Another form is asteatotic eczema, where the skin becomes extremely dry and cracked, often seen on the shins, particularly during winter, or in individuals who frequently take hot baths. The severity of itching is often intense, especially at night, causing significant sleep disturbances and greatly impacting quality of life. Chronic itching can also lead to thickened, darkened skin lichenification due to persistent scratching. It is crucial to seek medical help if you or a loved one experience any of the following symptoms: severe persistent itching that does not improve with self-care measures, a painful skin rash that is oozing or shows signs of infection, swelling, warmth, increased redness, pus or fever, symptoms that severely interfere with sleep, mood, or daily activities, home remedies that have not been effective after several weeks of consistent application, or if you are unsure about the cause of your skin problems, as it might be a different condition requiring specific treatment. To diagnose eczema in older adults, a dermatologist or general practitioner will conduct a thorough examination. The first step involves taking a detailed medical history and performing a comprehensive physical examination. The doctor will inquire about your medical history, including any existing health conditions, e.g., diabetes, kidney disease, all medications you are currently taking, both prescription and over-the-counter, a family history of allergies or eczema, and any suspected triggers you may have noticed. Afterward, they will carefully examine your skin to look for characteristic signs of eczema, as well as signs of other skin conditions that might resemble eczema. Excluding other conditions is an extremely important step in older adults, as many other dermatological conditions can present with similar symptoms to eczema, leading to misdiagnosis and ineffective treatment. For instance, contact dermatitis occurs when the skin comes into contact with an allergen, e.g. metals, fragrances, dyes, or an irritant, e.g. harsh detergents. Fungal skin infections can also cause itching and scaly rashes. Scabies caused by tiny mites leads to intense itching, especially at night. Psoriasis is another chronic inflammatory skin condition that can cause red, scaly patches. Furthermore, certain systemic or internal medical conditions, such as chronic kidney disease, liver disease, thyroid disorders, hyperthyroidism, or hypothyroidism, or even some types of cancer, particularly cutaneous T-cell lymphoma, can cause generalized itching without a clear rash, sometimes mistakenly diagnosed as eczema. In most cases, diagnosing eczema does not require specific blood tests. However, your doctor may order certain tests to aid in diagnosis or rule out other conditions. Allergy tests, such as patch tests or prick tests, may be performed if contact dermatitis due to an allergy is suspected. Swabs or skin scrapings might be taken if a bacterial or fungal skin infection is suspected. In rare cases, or when the diagnosis remains unclear after clinical examination and initial tests, your doctor might recommend a skin biopsy where a small skin sample is taken for microscopic examination. Finally, blood tests may be ordered to rule out internal medical conditions causing itching, as previously mentioned. An accurate diagnosis is the first and most crucial step in formulating an effective and personalized treatment plan, helping you manage eczema and improve your quality of life. Part 4. Modern treatment options. The good news is that there are many effective treatment options available for eczema in older adults, ranging from at-home self-care measures to advanced medications. The primary goals of treatment are to control symptoms, reduce inflammation, restore the skin's protective barrier, and prevent future flare-ups. A treatment plan is often designed in a stepped approach, starting with the simplest and safest methods, then progressing to stronger therapies if necessary. Topical treatments are the first and most crucial line of defense against eczema, especially given the delicate and sensitive nature of older skin. Among topical therapies, moisturizers, also known as emollients, form the cornerstone and are an indispensable component of any eczema treatment regimen. They help restore the compromised skin barrier, hydrate the skin, and reduce dryness. For older adults, selecting and using the right moisturizer correctly is paramount. Opt for thick creams or ointments that are fragrance-free, alcohol-free, and free from irritating preservatives or dyes. Products containing ingredients like ceramides, which help rebuild the skin's natural lipids, hyaluronic acid, a powerful humectant, glycerin, petrolatum, Vaseline, or shea butter, are excellent choices, as they create a protective film on the skin, preventing moisture loss. Avoid thin lotions, as they often contain a high water content and fewer moisturizing agents evaporating quickly, and potentially leaving the skin feeling drier. Moisturizers should be applied at least twice daily, or more frequently, if your skin is particularly dry or itchy. Most importantly, apply moisturizer within 3 minutes after showering or washing your hands. This is the 3-minute rule. When the skin is still damp, the moisturizer helps lock that moisture into the skin, maximizing the product's effectiveness. Apply a generous layer of cream to the entire body, not just the areas affected by eczema, and gently massage it until absorbed into the skin. Topical corticosteroids are potent anti-inflammatory medications often prescribed by doctors to quickly reduce redness, swelling, and itching during eczema flare-ups. They come in various strengths: low, medium, high potency, and your doctor will prescribe the appropriate type and strength based on the severity of your eczema and the location of the lesions. These medications are typically used for short durations, such as a few days to several weeks, to bring acute flare-ups under control. However, for older adults, extreme caution is necessary when using topical corticosteroids. Because their skin is thinner and more fragile, seniors are more susceptible to potential side effects of these medications, such as skin thinning, atrophy, stretch marks, or increased bruising. Therefore, strict adherence to your doctor's instructions is vital. Never self-increase the dosage, prolong the duration of use, or apply the medication over large body areas without medical guidance. Topical calcineurin inhibitors, TCIs, such as tacrolimus protopic and pimecrolimus elidel, are a safe and effective alternative to corticosteroids, particularly for thin and sensitive skin areas, like the face, neck, or skin folds. They are also very useful for long-term maintenance therapy and preventing flare-ups. TCIs work by modulating the skin's immune response, reducing inflammation, without causing skin thinning or other side effects associated with corticosteroids. The most common side effect is a mild stinging or burning sensation at the application site when first starting the medication, but this sensation usually diminishes after a few applications. A relatively newer topical medication is the topical phosphodiesterase 4 PDE4 inhibitor, specifically crisaborole Eucrisa. This ointment works by inhibiting the PDE4 enzyme, which helps reduce inflammation and itching. It is typically used for mild to moderate eczema and can be a safe option for patients who need to avoid corticosteroids. When topical treatments are insufficient to control eczema, or when the condition is moderate to severe phototherapy, light therapy may be considered. This therapy uses controlled ultraviolet UV light, UVA or UVB, to treat the skin. UV light affects the skin's immune system, helping to reduce inflammation and itching. Phototherapy must be administered under the close supervision of a dermatologist, typically 2 to 3 times a week at a clinic. Although effective, this therapy can carry risks such as sunburn or accelerated skin aging if not carefully monitored, and special attention should be paid to the senior patient's history of sun exposure. For severe widespread eczema that does not respond to the above methods, your doctor may consider systemic treatments, which are medications taken orally or by injection. Oral corticosteroids such as prednisone can help rapidly control severe eczema flare-ups. However, they are used only for short periods, usually a short course of treatment, due to numerous serious side effects with long-term use, especially in older adults. These side effects include osteoporosis, weakening of bones, making them prone to fractures, increased blood pressure, diabetes, cataracts, weight gain, and immunosuppression. Therefore, the use of oral corticosteroids in seniors requires very careful consideration of benefits versus risks and close medical supervision. Immunosuppressant medications like cyclosporin, methotrexate, or azathioprine may be used in cases of severe and persistent eczema that have not responded to other treatments. These medications work by suppressing all or part of the body's immune system to reduce the inflammatory response. However, they come with significant side effects, including an increased risk of infections, liver and kidney damage, and require close monitoring with regular blood tests. For older adults, the use of these medications necessitates a careful evaluation of benefits and risks, along with continuous medical supervision. Biologic therapies represent a major breakthrough in the treatment of severe eczema, particularly for patients who have not responded to traditional methods. Dupilumab Dupixent was the first biologic medication approved by the U.S. Food and Drug Administration (FDA) for moderate to severe atopic dermatitis. Dupilumab works by specifically targeting certain proteins, interleukin-4 and interleukin-13, that play key roles in the inflammatory response of eczema, rather than suppressing the entire immune system. The medication is administered via subcutaneous injection every 2 weeks. A notable advantage of dupilumab is its high efficacy in reducing itching and improving skin condition, while having significantly fewer systemic side effects compared to oral corticosteroids or conventional immunosuppressants. This is a very promising option that has brought great hope to many older adults suffering from severe eczema. Finally, JAK inhibitors are a relatively new class of oral medications that represent another advancement in treating severe eczema. Medications like baricitinib, Olumiant, upadacitinib, Rinvoq, and abrocitinib Cibinqo have been approved or are under investigation for severe atopic dermatitis. They work by inhibiting Janus kinase JAK enzymes involved in inflammatory signaling pathways within cells. While showing high efficacy, caution is advised when using these medications in older adults due to potential side effects such as an increased risk of infections, blood clots, or serious cardiovascular issues. Therefore, the use of JAK inhibitors also requires close and frequent monitoring by a physician. The choice of treatment method should always be thoroughly discussed and personalized by a dermatologist. Your doctor will consider the severity of your condition, your overall health status, including any coexisting medical conditions, the medications you are currently taking, and your personal preferences to formulate the most optimal treatment plan. It is crucial to have an open and honest dialogue with your doctor to ensure you receive the best possible care. Part 5. Daily Skincare and Management. Regardless of medical treatment, proper daily skincare and lifestyle management are pivotal to controlling eczema, especially in older adults. These are measures you can implement yourself to significantly improve your quality of life, reduce the frequency, and lessen the severity of flare-ups. Consistency and perseverance in daily skincare will yield long-term benefits. A suitable bathing and moisturizing regimen forms the two main pillars of eczema skincare. First, let's talk about proper bathing. The duration and water temperature during bathing are very important. Take quick showers only 5 to 10 minutes long and use lukewarm water, not hot. Hot water strips the skin of its natural oils, making it drier and potentially triggering an itchy sensation. Regarding bathing products, prioritize gentle, fragrance-free, soap-free cleansers with a balanced pH acidic or neutral that are specifically designed for sensitive or eczematous skin. Steer clear of traditional bar soaps, as they are often highly alkaline, which can damage the skin barrier and cause dryness. For severe eczema or skin infections, bathing in colloidal oatmeal can help soothe the skin and reduce itching, while a diluted bleach bath can help reduce inflammation and eliminate Staphylococcus aureus bacteria on the skin. However, diluted bleach baths should only be performed under the guidance and supervision of a doctor to ensure safety and proper concentration. After bathing, do not rub your skin completely dry. Instead, gently pat your skin with a soft towel, leaving a slight layer of moisture on it. Immediately after bathing or washing your hands within 3 minutes, apply a generous layer of moisturizer to your entire body. This is the 3-minute rule we discussed. It helps lock that moisture into the skin before the water on the surface evaporates. As previously discussed, prioritize thick creams or ointments that are fragrance-free, hypoallergenic, and contain deep moisturizing ingredients. The frequency of moisturizer application should be at least twice daily, or more often if your skin is very dry or itchy. Don't be afraid to apply a generous amount of moisturizer. For eczematous skin, more is often better. To avoid contaminating the product, use a clean spoon or spatula to scoop out the cream instead of directly using your fingers. Identifying and avoiding triggers is another crucial step in eczema management. Each person may have different triggers, so meticulously monitoring and documenting the factors that provoke your flare-ups can be very helpful. Regarding clothing, prioritize wearing soft, loose-fitting, breathable cotton fabrics to reduce friction and allow your skin to breathe. Avoid wool, rough synthetic fibers, or tight clothing as they can chafe and irritate the skin. For detergents, use fragrance-free, dye-free laundry detergents specifically designed for sensitive skin, free and clear. Always rinse clothes thoroughly to remove any lingering detergent residue that could irritate the skin. Avoid soaps, perfumes, and cosmetics with strong fragrances or high alcohol content, as these are common irritants. When handling household chemicals, even mild ones, always wear protective gloves. Controlling temperature and humidity in your living environment is also very important. Keep your room temperature stable, not too hot or too cold. Dry air, especially during winter or when using air conditioning or heating systems, can rapidly dehydrate the skin. In these cases, using a humidifier in your home can help maintain the necessary moisture levels for your skin. At the same time, try to avoid excessive sweating. If you do sweat, take a quick, lukewarm shower and change into clean clothes to remove sweat and mineral salts from your skin. Regarding allergens, if you know you are allergic to pollen, dust mites, or pet dander, take measures to minimize exposure. Keep your home clean, vacuum regularly using a vacuum cleaner with a HEPA filter. Use dust mite-proof pillowcases and mattress covers, and limit direct contact with pets. Regarding food, the role of food in eczema in older adults is generally less clear than in children, and is often not a primary trigger. However, if you suspect a particular food might be triggering your eczema flare-ups, discuss it with your doctor or a registered dietitian before eliminating it from your diet. Do not arbitrarily remove multiple food groups without professional guidance, as this could lead to nutritional deficiencies. Stress management is an often overlooked but crucial aspect of eczema control. Stress does not directly cause eczema, but can undeniably exacerbate flare-ups through complex immune neuroendocrine mechanisms. Older adults may face numerous sources of stress: loss of loved ones, declining health, loneliness, life changes. Practicing relaxation techniques, such as deep breathing exercises, mindfulness meditation, gentle yoga, or listening to calming music, can help reduce stress levels. Engaging in personal hobbies, social activities, reading, gardening, or any activity that brings joy and relaxation can be very beneficial. Ensuring adequate sleep, around 7 to 9 hours per night, is essential. Severe itching can cause chronic sleep deprivation, and lack of sleep in turn worsens itching, creating a vicious cycle. If you have difficulty sleeping due to itching, discuss it with your doctor to find solutions. Finally, maintaining social connections is very important. Stay in touch with friends and family, and participate in clubs or interest groups to avoid feelings of loneliness and improve mood. Combating the itch is one of the biggest challenges in eczema. Here are some tips to reduce itching without further damaging your skin. Always keep your fingernails short and clean to minimize skin trauma when you scratch unconsciously. Apply cool compresses. Placing a cool, damp cloth and ice pack wrapped in a thin towel to prevent ice burn, or even taking a cool bath on the itchy area, can provide immediate relief. For some individuals, oral antihistamines, e.g. Benadryl, use with caution in older adults due to potential side effects like drowsiness, dizziness, and other adverse effects. Always consult your doctor before use. Might help reduce itching, especially at night, to improve sleep. Most importantly, instead of vigorously scratching with your fingernails, gently rub or pat the itchy area to soothe the sensation. To prevent unconscious scratching at night, you can wear soft cotton gloves or thin socks while sleeping. Preventing infection is another critical factor. Eczematous skin has a compromised barrier, making it susceptible to bacterial, especially Staphylococcus aureus, viral like herpes simplex, and fungal infections. Infections can severely worsen eczema and lead to dangerous complications. Practice frequent hand hygiene using mild soap. Clean minor scratches or cracks on your skin with water and mild soap. Avoid picking at or bursting oozing blisters, as they can be a sign of infection, and bursting them can spread bacteria. It is crucial to recognize the signs of infection: increased swelling, warmth, redness beyond normal, increased pain in the eczematous area, pus, or red streaks spreading from the wound. Systemic signs can include fever or chills and swollen lymph nodes in the affected region. If you experience any of these signs of infection, seek medical attention immediately. Your doctor may prescribe oral or topical antibiotics or antiviral medications, depending on the type of infection. Consistently applying these daily skincare and preventive measures can make a significant difference in controlling eczema and improving your quality of life. Consider it an indispensable part of your daily self-care routine. Part 6. Living with eczema and quality of life. Eczema is not merely a dermatological issue. It can profoundly impact many aspects of life, affecting the physical, mental, and social well-being of individuals, particularly in older adults. However, with the right approach, including a clear understanding of the condition, effective symptom management, and seeking appropriate support, you can absolutely live a full and positive life. Older adults with eczema often face numerous psychological and social challenges. One of the most significant impacts is sleep deprivation. Intense itching, especially at night, can prevent individuals from sleeping soundly or cause frequent awakenings, leading to chronic insomnia. Prolonged sleep deprivation results in fatigue difficulty, concentrating irritability, and reduced ability to cope with stress during the day. Lack of sleep also exacerbates the itch-scratch inflammation cycle, as insufficient rest can heighten the sensation of itching. Chronic itching, persistent discomfort, and anxieties about skin appearance can lead to serious psychological issues such as depression and anxiety. The feeling of helplessness when unable to fully control symptoms can leave individuals feeling isolated and hopeless. Some older adults may avoid social activities or withdraw from relationships due to concerns about their skin's appearance, fear of others noticing their lesions, or simply due to constant discomfort. This can lead to social isolation and worsen mental health problems. Simple daily activities like bathing, dressing, sleeping, or social interactions can become significant challenges, thereby substantially reducing overall quality of life. You are not alone in your battle with eczema. There are many available support resources that can help you overcome these challenges. First and foremost is support from family and friends. Share your feelings, difficulties, and needs with your loved ones. They can assist you with skincare, e.g., applying cream to hard-to-reach areas, reminding you to take medication on time, or simply by listening and offering encouragement. Your doctor and healthcare team, including your dermatologist, primary care physician, and nurses, are your most important partners in managing eczema. Do not hesitate to ask questions, clearly articulate any concerns or problems you are experiencing. Describe in detail the intensity of your itching, your triggers, and the impact of eczema on your daily life. An open dialogue will help your doctor better understand your condition and tailor your treatment plan accordingly. Participating in eczema support groups, whether online or in person within your community, can be immensely beneficial. Sharing experiences with others who face similar challenges can provide deep empathy, useful advice from those who have been through similar situations, and reduce feelings of isolation. Organizations like the National Eczema Association in the United States offer a wealth of resources, information, and listings of support groups. If you feel overwhelmed by stress, anxiety, or depression due to the impact of eczema, consider seeking help from a mental health professional such as a psychologist or psychiatrist. Cognitive behavioral therapy (CBT) is an effective approach that can help you learn how to manage itching sensations, cope with stress, and modify negative thoughts associated with your condition. Maintaining a healthy lifestyle can also improve overall health and the ability to cope with eczema. Regular gentle exercise can help reduce stress and improve blood circulation, which benefits skin health. Activities like walking, swimming in pools with low chlorine, and showering immediately afterward, or gentle yoga can be very helpful. Choose cooler times of the day for exercise to avoid excessive sweating, which can irritate the skin. A balanced, nutritious diet is crucial for overall skin health. Eat plenty of fruits, vegetables, whole grains, and lean proteins. Avoid processed foods, sugary foods, and unhealthy fats. While there isn't one universal eczema diet scientifically proven to work for everyone, some individuals may find benefit from incorporating foods rich in omega-3 fatty acids like fatty fish or flaxseed, or probiotics in yogurt, kefir, to help reduce inflammation and improve gut health, which can be linked to skin conditions. However, always consult a registered dietitian or your doctor before making any major changes to your diet. Ensure you drink enough water daily to keep your body hydrated from within, helping to prevent dry skin and maintain its elasticity. If you are a caregiver for an older adult with eczema, your role is incredibly important and should be highly valued. Educate yourself thoroughly about eczema, especially the unique challenges and manifestations in older adults. This understanding will help you support them better, assist them with treatment adherence, help them apply moisturizers and medications on time, and remind them about doctor's appointments. Create a favorable living environment. Ensure the patient's living space is clean, cool, and has minimal irritants like dust, pet dander, or chemicals. Most importantly, listen and empathize. Do not underestimate the impact of eczema on their mood and quality of life. Show patience and understanding. Monitor and report. Observe their symptoms, any changes in their skin, or new signs of infection, and report them promptly to the doctor. Finally, caregivers also need to practice self-care for their physical and mental well-being to be able to provide the best support to their loved ones. Seek caregiver support resources to prevent burnout. Living with eczema in older age requires patience, persistence, and a comprehensive approach. But with solid knowledge and the right support from the medical and social community, you can absolutely manage this condition and maintain a comfortable, fulfilling, and high-quality life. Part 7. When to seek urgent medical care and summary. While chronic eczema is generally not an emergency medical condition, there are certain warning signs that warrant immediate medical attention to prevent severe complications and protect overall health. Seek urgent medical care if you or a loved one experience any of the following signs. If the eczematous skin becomes significantly swollen, intensely red, warm to the touch, severely painful, develops pus, or shows red streaks spreading from the affected area. Signs of cellulitis. These symptoms are often accompanied by systemic signs such as high fever and chills, indicating a serious infection requiring immediate antibiotics. A particularly dangerous complication of eczema is herpes eczema, also known as eczema herpeticum. This condition occurs when the herpes simplex virus, the virus that causes cold sores, infects eczema-affected skin. It is characterized by numerous small clustered blisters that resemble cold sores accompanied by fever, general malaise, and sometimes swollen lymph nodes. This is a serious condition that can spread rapidly and requires immediate antiviral treatment. If an eczema rash spreads very quickly across the body, or if symptoms suddenly become severe and unmanageable, it is also a sign that requires immediate medical evaluation. Eczema around the eyes showing signs of redness, swelling, pain, or affecting vision also warrants urgent care to prevent permanent eye damage. Though rare, if eczema symptoms are accompanied by shortness of breath, swelling of the face or tongue, or a feeling of choking, these could be signs of a severe allergic reaction, anaphylaxis, requiring immediate emergency medical attention. To summarize the key points we have discussed in this comprehensive video, we have learned that eczema or atopic dermatitis is a chronic, non-contagious skin condition characterized by a dysfunctional skin barrier and an overactive immune response leading to itchy, dry, and inflamed skin. In older adults, eczema presents unique characteristics and challenges due to the natural aging process of the skin coexisting medical conditions and the use of multiple medications. Symptoms in seniors can be atypical, often manifesting as severe itching, generalized dry skin, or specific forms like nummular eczema and astiotic eczema. Accurate diagnosis is crucial, requiring a doctor to rule out other skin conditions and internal medical conditions that may cause itching or rashes. The good news is that there are many effective modern treatment options, ranging from consistent moisturizing and topical medications to phototherapy and advanced systemic therapies like biologics and JAK inhibitors, all tailored to individual patient needs. Proper daily skincare is key to managing eczema, including appropriate bathing practices, continuous moisturizing, and identifying and avoiding personal triggers. Furthermore, stress management, maintaining a healthy lifestyle, and seeking psychological and social support are incredibly important for significantly improving quality of life. Finally, it is essential to always consult with a dermatologist or a qualified healthcare professional for all decisions regarding your eczema diagnosis and treatment. We hope that this detailed video has provided you with valuable and useful information about eczema in older adults. We understand that living with this condition can be challenging, but please remember that you are not alone on this journey. With solid knowledge and the right support, you can absolutely manage this condition and live a comfortable, fulfilling, and high-quality life. We are always here to provide you with reliable knowledge and the necessary support on your health journey. Thank you for taking the time to watch this entire video. We wish you and your family good health, happiness, and healthy, beautiful skin